Hi, this is Dr. Christopher Vernaleken. Welcome back to the podcast. And I have
Hi,
with me my wonderful colleague.
hi, everybody. It's Dr. Lindsay Renzullo. We're glad to have you back. Thanks for coming.
And today we have a special guest who is Dr. Chris Thomson from out in California, one of our fellow Ethos hospitals. Hi, Chris.
Hi, how's it going?
Good. So, he is a veterinary surgeon, and we are devoting this episode today to talking about veterinary surgery and also some of his special interests in surgery, which are shared by many of the surgeons throughout our organization. So, Chris, why don't you give us a little bio of you? Take as much time as you would like.
Sounds good. Thanks for the introduction. Thanks for inviting me on the podcast. It's very exciting, and love what you guys are doing, especially for the Ethos hospitals. It's really exciting to hear about all the various things and hear from the doctors that we email back and forth with. And so it's great to get introduced. Like you said, my name is Chris Thomson. I'm originally from South Dakota, actually. Every time I tell people I'm from South Dakota, I feel like the average response is that I'm the first person that they've met from South Dakota.
Yeah.
There's generally not many of us, and
Yeah,
most
you're the
of them
first
stick
person I've
around
ever met
South
from South
Dakota.
Dakota.
Yeah.
That's awesome.
But spent most of my life in the Midwest. So again, grew up in South Dakota, went to Iowa State for undergrad, and then Minnesota for vet school. From Minnesota, went to Wisconsin for internship, and then back to Minnesota for residency. So kind of did a loop of all of the classic Midwestern states. From residency, I did go to Colorado State University for a fellowship in surgical oncology. Have spent most of my training thus far really getting into some of the various aspects of veterinary surgery, but very specifically into surgical oncology, minimally invasive surgery, as well as interventional radiology. So a lot of very exciting things, a lot of very new areas for veterinary medicine in particular. And now I'm down in sunny San Diego at the Veterinary Specialty Hospital, specifically our North County location, for starting up a program in minimally invasive surgery, surgical oncology, IR, and then also bringing in a pretty significant clinical research aspect to the program there.
That's awesome.
Awesome.
And, when you sort of are, discussing your career path and how you got to where you are right now, you discussed residencies and internships and things like that. So, one of the differences between like a veterinary surgeon, like a board certified veterinary surgeon versus sort of a primary care surgeon is that sort of extra additional training and board certification. So it does, really have a lot of extra work that needs to go into it, as far as training and things like that.
Yeah, it's a very rigorous couple of years. It's one of those things where people always say it's one of the 3 or 4 or 5 years of my life that I absolutely love, but would never want to do again, just because it is a very intensive couple of years to really learn the ins and outs of whatever specialty that you're going into. So, particularly for surgery, is something that again our daily life really revolves around learning every aspect of surgery, meaning the preoperative workup, the actual surgical procedure itself, and then the postoperative care for all of those patients. And one of the things that a friend or a colleague mentioned to liken what it is to be a surgeon versus just a veterinarian that practices surgery is that it's very similar to being a line cook versus a chef, where a line cook definitely can make all of those same meals, can make the exact same recipe. But when you have the chef, the big thing is that you really know the ins and the outs of what goes into it and the refinement and the ability to adapt to whatever is presented. So it's interesting and exciting, and I love the specialty of surgery in particular, obviously in particular, but it's exciting to be at a place where we can really focus and refine what we're doing for those patients.
Yeah, so
Yeah,
a
because
lot
I
of
was
our
gonna
audience, I think, many of them are, some of them are employees, thank you, at our Ethos hospitals, but many of them are our clients. And I think that's always a confusing point is like Lindsay and I are both general practice doctors and we do some surgery, right? We have perfected our techniques in some of these surgeries, right? So, like
yes.
your very routine stuff, your mass removals, some of the emergency surgeries. But there's much that is well beyond our expertise, either because we've never done these procedures or just have done so few of them or just watched them,
Right.
or it requires such refined instrumentation, like some of the minimally invasive things that you can do some things very comfortably and safely with your general practice doctor, but then there's going to be a point at which we can't anymore,
Right.
and that's where our board certified colleagues come in.
Yeah, and I feel like they're a vital source or they're essential source, in our community because, you have to trust your regular veterinarian. If you have your patient go there and they are referring you to a surgeon, there's a reason why they're referring you to that surgeon. That skill level or the particular type of surgery, whatever it may be, there may be parts of it that they aren't that comfortable with. And so, just as in human medicine, there are so many different specialties and fields. I feel like people are very understanding of that. They understand that if they have a problem with their spine or their back, they're going to the spine doctor, whereas they wouldn't go to the regular just PCP to have them do surgery on their back. So,
Yeah.
I feel like people are much more understanding it in the human realm of medicine. And it's just coming now. I feel like a lot of people are getting a little bit more understanding of the various specialties, the fact that like there is a need for all of these particular specialties in our field.
Yeah, absolutely.
Yeah.
And it's one of the exciting things, especially as a specialist, to develop that relationship with the primary care physicians or veterinarians in the area, just because, like you said, there's so much that is part of the comprehensive care for the patient that it's really valuable to get the entire team for your pet, meaning that the one thing about being a specialist is there are a lot of clients that will come to us and we'll do what we need to do for surgery, but then in the aftercare they'll ask me something about diet or something about the patient's skin or something about the patient's teeth.
Yeah,
and
you love that,
I'm
right?
I am the first to admit that I know nothing about any of those topics, and even for my own pets, I have to go to friends and establish a primary care veterinarian, just because again I'm completely lost when it comes to those things. And so it's really interesting, and it's always a fun aspect of that client care management, is that when they really figure out that this is a divided healthcare team, and we each play our roles. And so it's always exciting to see that, both for the community practice as well as for the clients.
Now, you had mentioned a lot when you were speaking initially about like interventional radiology and interventional therapies and things like that. Talk to us a little bit more about that for our listeners, about what that really entails.
Yeah, so it's really exciting. Even in human medicine, it's a very new field, meaning that it's just now getting to the point where there are interventional radiology residencies and fellowships, even in human healthcare. And so in veterinary medicine, we're very much still in the early phases of what that means for our patients and our pets. But the general assessment or the understanding of interventional radiology is that we use diagnostic imaging, but then use that to actually provide some form of therapy. And so the most common form of interventional radiology is through the use of fluoroscopy or live or video x-rays, for us to be able to do a procedure that gets the exact same outcome and results, sometimes even better outcome and results, with a much more minimally invasive manner. And so one of the first things that, or I guess one of my favorite cases, I guess, for interventional radiology is something like an intrahepatic portosystemic shunt. And for the listeners, that's essentially when there's an abnormal blood vessel in the body that should be going towards the liver, but instead of all of that blood going to the liver to get detoxified, it actually just passes completely through the liver and goes into systemic circulation or into the heart and lungs and to the brain and the rest of the blood system. And so the problem is that those patients have a very severe buildup of everything that the liver should be detoxifying. And so we need to find a way to plug up that bypassing blood vessel. And historically, meaning 20, 30 years ago, the only option was a big open surgery, and that surgery was highly risky, meaning a lot of those patients were dying either immediately during the procedure or after the procedure because of the risk related to that liver vessel surgery. And so now we've come up with a technique where just through a tiny catheter that goes into the neck, we can actually pass a couple of devices and specific coils that will block off that blood vessel so that the blood actually normally returns to the liver. So we can do the exact same procedure without the risk of those patients dying because of surgery or having very severe consequences. And it can be done through as simple as a small catheter in a blood vessel in the neck. And so it's really exciting to be able to provide some very advanced techniques and very minimally invasive options for patients that, again, otherwise would have a fairly high risk procedure that, again, we can do through a minimally invasive option.
Yeah,
Awesome.
and there are some interesting one of your interests being oncology. I know there are some of those interventional radiology techniques for oncological patients too. Is that right? And now oncology for our listeners is cancer, the study of cancer. So oncology is a big field in veterinary medicine as it is in humans, and surgeons have a vital role to play in that. So yeah, talk to us about those techniques that you.
Yeah, it's exciting, and it's also kind of it's interesting to be a surgical oncologist that is doing interventional radiology, because a surgical oncologist, also for the listeners, so a surgeon is someone that does surgery, obviously, and specialized for surgery. There is a new field in veterinary medicine, specifically surgical oncology, where we do extra training and specific fellowships towards learning the ins and outs of a cancer patient. And typically those procedures in particular are what I would consider a very maximally invasive or a big surgery, meaning that historically surgical oncology is for patients that need something like a very big tumor removed from the face, or a big tumor removed from a leg or from the body wall that even a lot of board certified surgeons are not comfortable with. And so they'll make that referral to a surgical oncologist. IR for cancer patients is really flipping that switch, where again, we can get the same or equivalent outcomes with a much lower risk for the patient for side effects and some life-limiting comorbidities. And so interventional oncology, which is IR for oncology patients, is again something newer in human medicine that we're now adapting to veterinary medicine, where if a patient comes to me and they have a very big liver tumor, for instance, that's also a very high risk surgery or procedure for those patients. And a lot of clients are just not willing to accept the risk related to that surgery. And so it's good to be able to offer, again, a minimally invasive option where instead of jumping in and going after that liver tumor with surgery, we can do the same thing where I can just pass a very small catheter in one of the arteries in a back leg and take that catheter all the way up to the artery that's directly feeding the tumor to be able to pass what we call a chemoembolization treatment, where we give a traditional chemotherapy, but at roughly a 20-fold higher dose to the tumor itself, bypassing the systemic circulation. And then follow that with an embolizing agent, which is typically either some kind of a bead or some kind of a specific medication that completely blocks off the blood vessels supplying the tumor. So it's really cool because it's such a very selective treatment that is really tailored just towards that tumor itself, which can preserve the rest of the liver. It doesn't cause any systemic or body-wide effects from the chemotherapy. The patients are, instead of doing a massive recovery from a liver lobectomy, they're within hours walking away from that procedure feeling great with very little pain, very little discomfort. So again, it's really exciting to be able to offer the standard liver lobectomy, but then also have this other minimally invasive option that is really something that is paving the way for us to get the same equivalent outcomes, but with a lot less pain and suffering for those patients.
This is just my curious person asking, what happens to that tumor inside their body when you embolize it? Like it just absorbs?
Yeah, very good question. So it essentially, it becomes scarred down. So the tissue does die off. And one of the scary things is that if you have any dead tissue in the body, one of your worries is that it can become something like an abscess. And we don't really see that particularly for the livers. And we're now doing this technique for other tumors as well. So for nasal tumors, for prostates, it's an ability for us to be able to treat them and kill off the tumor and whatever that local body part is. But the interesting thing is that the body is able to essentially just have that dead tissue and not have a major issue. It's very rare for them to develop an abscess. Typically, it just becomes a cystic type of tissue. So a non-living, just kind of
we'll call it a bleb, just a bleb.
Just a bleb of what was once a tumor is now no longer a problem. Yeah,
that's so exciting though too, because I feel like in veterinary medicine we're always worried about the quality of life for our patients, right? So that sounds as though it could be just an amazing option for owners that don't want to have their patients go through a big surgery, but still sort of have a good quality of life and be able to still recover quickly and feel better, in a way that makes people feel, oh yeah, actually, sorry, you were discussing cost. Yeah, what would the cost be something for something like that?
So it depends on the procedure. So most of our costs are equivalent between a minimally invasive procedure and a traditional therapy. There are some differences, particularly in the workup, that may go into it. So for instance, there are times that we can find a liver tumor from an ultrasound. And from that ultrasound, there are times that we could just go straight forward into surgery. But if we are going to do the interventional radiology option, then we often need a CT scan prior to that. And so that adds to the expense. The equipment costs are generally greater for the minimally invasive option, meaning that if I'm going to remove an adrenal tumor with a traditional surgery, the equipment costs are the same as any typical surgery. If I'm going to do it with laparoscopy, then there is a cost of the setup and the additional cost related to the disposables for that particular surgery. And so that does add up. But the interesting thing that I've found is that because these patients are having less pain, having less hospitalization time, a lot of the total cost for the client is actually washed out. Because again, if I can do an open adrenalectomy, meaning remove an adrenal gland with a tumor, and that patient has to be hospitalized for 2 to 3 days, versus if I can do it in a minimally invasive manner, there's more upfront costs. But if the patient goes home the next day, then again, those hospitalization costs really wash out.
That's true. That's awesome.
Yeah. So, and I mean, minimally invasive can be even down to surgeries that we consider very conventional, like a spay, or the prophylactic gastropexies. Like, there's a lot
Yeah.
of these things that we can do minimally invasively and do in an open technique. It's just a matter of some of them, yes, are more expensive, right? If you do a minimally invasive spay, it does end up being more expensive cost-wise often than
Yeah.
having a spay done at your GP. But, you have to balance out the post-op stuff. I mean, most of these procedures in humans are all done minimally invasively now,
True.
right?
Yeah.
Yeah.
So,
Yeah.
and
And
there's a reason for that.
yeah, and it really depends on also the individual patient. And that's where, again, that conversation is really beneficial to have both a primary care veterinarian and a specialist. Because if you have a typical, let's say a 12-week-old dog or puppy that you want to do a spay on, that procedure very easily and very straightforward can be done through a routine or conventional spay. But if you have a 2-year-old Doberman that has already gone through 1 or 2 heat cycles, that's, as we all know, going to be a much bigger procedure to do traditionally. And if we want to add on the gastropexy, if we can do that with minimally invasive, that's really a patient that I think would benefit from the minimally invasive option compared to, again, a much younger patient where we can get by with the same incision size. So,
It's funny because I feel like a lot of owners feel as though if it's a bigger dog, the surgery should be easier for like the veterinarian, right? So often, we have these owners that have very large dogs and, they think that these are really routine surgeries. So especially now when there's a bunch of debate in the veterinary world about when to spay your dog or, spay or neuter your dog, we're getting a lot of older females that have gone through a heat cycle, and those surgeries in like larger, deeper chested dogs, those are those are awful
And
surgeries.
I
yeah,
mean, and I
Awful.
don't think that owners
yeah,
realize when oh, when you schedule me for like this 1-year-old kind of overweight lab,
yep,
I'm just like, oh yeah, I'll do it, but I'm
yeah,
not going to be happy. I would
Yeah.
way rather send it to you for minimally invasive surgery.
100%.
yeah.
Yeah.
And
100%.
it's so funny. It's always been amazing to me that a spay has somehow been notorious or been put into this box where it's supposed to be an easy, straightforward procedure. But it's truly a major abdominal procedure, meaning that yes, on a small puppy, that's something that can be done very easily and very quickly. But again, on these older patients, that's a true abdominal procedure, meaning that it's going to be a big incision. It's going to be a big blood vessels feeding the ovaries and the uterus. And so I think that it is something that, again, a lot of owners think that any spay is a spay, and that's absolutely not true. And
Yeah.
and it's, again, where that conversation really comes into play with the client and the entire comprehensive care team for the pet.
I do.
Yeah,
I
I
have vision
choose
that as time goes on, that like laparoscopic stuff is going to be much more
yeah,
common in veterinary
totally,
medicine. I think
totally.
already we're trying, we have boarded surgeons at Bulger, and they do those surgeries, and trying to convince that, like, all the clients that this is might be a little bit more of an upfront cost, but in general, these patients recover so much quicker, and it's a much less invasive procedure. So I feel like it's hopefully going to become a more common thing as time goes on.
And
Yeah.
then
And
arthroscopy too, I don't know how much of that do you do arthroscopy as well?
yeah, I was going to say that the two other things that I think are really paving the way and making a massive difference for our patients are thoracoscopy, so minimally invasive surgery within the chest cavity, as well as arthroscopy. And I think there are two different big benefits for those patients. So anytime that we're doing cardiovascular cardiothoracic surgery, that is a very major undertaking for those pets and for the clients, in that to get access to those structures, you either have to go through the breastbone, which is obviously a very maximally invasive
Yeah.
procedure, or you have to spread the ribs. And so doing that with a minimally invasive option, we don't have to spread the ribs. We just have very small ports that really minimizes the pain and discomfort for that. And so thoracoscopy or minimally invasive surgery in the chest, I think, is such a, once you get over the learning curve of those particular surgeries, there's a massive benefit to those patients. And that's something that within Ethos, we're actually doing a very major overhaul of a lot of our surgery specialties to really push for thoracoscopy. And we're actually coming out with some research into that space soon. And that's something that we can talk about later. But like you mentioned, arthroscopy, I think, is also one of the other big areas that we're really getting into in veterinary medicine, and in Ethos in particular, where I know that our greater Ethos veterinary health system actually just made a massive investment in getting arthroscopy for essentially all of our surgeons at our hospitals. And different from laparoscopy and thoracoscopy, the biggest benefit of arthroscopy is that you get such a magnified view of everything that's going on, meaning that the incision for arthroscopy versus an open arthrotomy, or kind of a conventional look into the joint, it's from 4 inches down to 1 inch. So obviously that's not the biggest difference maker for those patients, but the real big difference between arthroscopy and an open arthrotomy is that you have a 10 times magnified view looking inside that knee joint for those patients. And so instead of like being away from the patient, trying to see if there's any small tears within the meniscus or what's going on within the ACL for a dog, or a cruciate ligament in a dog, you get this massive widescreen view of everything that's going on. And so you really pick up subtleties that you just can't identify in an open arthrotomy. And there's a lot of data now to suggest that if we can perform these more minimally invasive orthopedic surgeries, you get such a better view that you're picking up a lot more diagnostics and picking up a lot more disease and damage that may go missed if you do a conventional option. And so again, I think that it's a new realm for a different reason. But again, that minimally invasive option is really growing in its potential and helping our pets that gets benefited by going from a specialty service such as the surgeons at Ethos. Yeah.
Exciting.
Yeah, so you had mentioned research. So research is something
Yeah.
that I'm not sure that most clients really realize is part of maybe any medical field. Like sometimes when I talk to owners, they're not even aware of how much research happens with human as well. But we
Mhm.
obviously research plays a huge role in veterinary medicine. And like from a high level, it's how we know what works, right? So tell us about, your role in that.
Yeah, so research is something that number one, it's always been one of my biggest passions in veterinary medicine. It's what we've done, or what I've done through vet school, through residency, and through fellowship, and now in clinical practice. But research is always a little scary conversation, on the basis of people really don't want to think that their pet is going to be a mouse or a guinea pig, I guess, for some kind of new untested project. And that's really not what we're doing. I would say the biggest thing that we're doing for clinical research in veterinary medicine is that we want to not just provide the gold standard care for your pet, but we want to provide the gold standard care and see how we can improve that care. And so how we generally perform clinical research, or the way that we integrate clinical research into a specialty practice, is that once something has been proven to be safe and effective, then we take those techniques, we take those medications, we take those procedures that, again, we know is safe, we know it's been done on a variety of pets. We want to see if it actually makes a difference for our pets. And so, for instance, one of the new clinical research trials that we're going to be opening up at North County, or at San Diego in our North County practice, is again performing a minimally invasive lung surgery for patients with cancer, to prove that we can actually have a major clinical benefit for those patients from a pain standpoint, meaning that, yes, we can do these procedures open or in a conventional way, but we want to really define this is how big of a benefit you get for those patients from doing it from a minimally invasive option. So one of the first trials that we're going to be opening up, it's called the MIMIC trial, in which we're doing a minimally invasive metastasectomy. So for patients that have developed a pulmonary nodule from a different cancer, traditionally, again, you have to spread the ribs to go in and try and remove that tumor. We're going to do all of that through a couple pinpoint holes into the chest cavity to be able to get the same outcome for those pets in a proven manner, but then really clarify and define exactly what that benefit is for the pet. So it's a really exciting way to improve care for all of our pets, prove exactly what these techniques can do for those pets, and again, provide gold standard care that often you can only find in specialty human healthcare, but actually for our veterinary patients.
That's actually what I was going to bring up. A point is that, one of the fascinating things, or the things that I love, is sort of the spillover between human medicine research and veterinary medicine research, because often, we will take what maybe has worked in human medicine and see if we can extrapolate that, if it can work in veterinary medicine. But the same is true vice versa. I mean, sometimes these human medicine doctors and researchers are looking at what's going on in veterinary medicine and whether or not they can sort of utilize that to benefit our, the humans. So I find that also fascinating. Do you see a lot of that with the surgery in particular?
Yeah, I would say for surgery, in particular for oncology or cancer care, I think that research is it's such a valuable space in veterinary medicine, because it's a lot of these therapies, a lot of these procedures are incredibly expensive. And so if we can actually get this gold standard therapy through a clinical trial, we can often have whatever the clinical trial is pay for that care for the patient. So instead of having the client to spend thousands of dollars for, again, this minimally invasive surgery, if we can do that through a clinical research project, we can get a vast majority of those costs taken care of through the clinical trial. And so, again, we can provide gold standard level care that otherwise would often be too expensive or unreachable, unattainable for a lot of these clients. And then the biggest benefit, I think, is that dogs and cats get the exact same cancers as humans do. So, for instance, a lung tumor in a dog is so genetically similar to what we see in humans. The proteins are very similar. The genes are very similar. The response to treatment is very similar. And so the biggest difference is really the timeline, meaning that for our dog patients, we know that if we can get them to live to 12 years old, 14 years old, that's phenomenal. And we can study the progression of disease in a period of 1 to 2 years, which on the human side would take 5 to 10 years. And so we can actually very quickly accelerate the discovery of how the drugs interact with a particular tumor, and how, again, a therapy can actually be effective for a patient. And our actual dogs, that, again, we're providing that gold standard, we're finding that disease response to treatments that then can go on to actually improve the lives of humans with a similar disorder. And it's really exciting because, again, it's something that would often be unattainable. And just as a reference, or one of the greatest ways that I've seen this play out is during my residency, I actually did research on brain cancer. So dogs get, particularly bulldogs and brachycephalic dogs, they get very similar brain tumors that humans get. And it can be a very, very devastating disease, both for dogs and for humans. And it's a challenge to be able to treat dogs because, again, the standard of care, the gold standard, is going to be brain surgery followed by some form of chemotherapy. And a lot of clients can't afford brain surgery because that's obviously a very expensive thing to undertake. And so through the clinical trials that we had fully funded, we were able to do these brain surgery procedures for the patients. We were able to integrate chemotherapy after. We were able to integrate immunotherapy. So again, using the body's own immune system to try and fight off the tumor. And this is a gold standard care for a human with a brain tumor. We're able to do that in your dog, and again, assess to see for something that we already know is safe, we can assess to see how effective that is for improving the outcome for those patients. And then once we have that data and information, we actually saw what we were doing for these dogs with brain cancer translate into human clinical trials as well. So
awesome.
It was so exciting to see something that we had worked on for 3 to 5 years, had very good success with dogs, then go on to be performed in humans, because we saw that it was very effective in our dog patients. And so they saw that benefit and then translated it to human healthcare to actually improve the care of cancer for patients with brain tumors.
It's so cool. I love that.
Yeah, and a lot of the time with these clinical trials as well, a lot of the time there are patients that would have not had the treatment had it not been for the trial. I think about this Ethos push study that where most of our hospitals are in right now, and this is a study of hemangiosarcoma, which is a uniformly lethal disease in our canine patients. And so, basically the study affords the owners the opportunity to, number one, possibly have a surgery that they wouldn't have chosen to have due to cost, and embark upon chemotherapy, really all, sponsored by the study that they probably wouldn't have done. And so, there are really good opportunities when those studies exist. And it's not like you're doing trials of drugs, as you said, that are unsafe or unproven. It's, does this protocol compare to this protocol favorably, right?
Yeah, and I'm glad you brought that up. I could probably talk about the push study for hours if you asked me, but it's one
Well, I
of
couldn't
the
have not
things-
brought it up because it's like constant emails that they send us about it.
It's one of those things that very rarely in your career do you get to participate in something that is like as groundbreaking and as something that is going to forever affect the clinical practice of veterinary medicine as this push study is. And it's so exciting because it's a fully funded 400 dog study, and that is absolutely unheard of anywhere else outside of Ethos, where they've made this investment to provide care for 400 dogs, which again, you just don't see that in veterinary medicine. And it's so incredible that we'll be able to provide the gold standard care and then prove what is the most effective drug for such a debilitating disease, like you mentioned. Again, hemangiosarcoma, it's a disease of blood vessels in dogs, and it's something that I've started doing research in vet school. I did some research in residency and now in clinical practice, because it's such a devastating disease for the patients and for the clients that we've not really made a big jump in their overall survival for years to decades even. And this clinical trial is, again, it's using drugs that we know are safe in dogs, and it's providing those drugs for essentially free for these clients to be able to get that chemotherapy medication to see what we can do to actually improve the overall survival. And I think that one of the big things now that we're talking about with chemotherapy is also such a terrifying thing to consider for a client to put their pet through. And that's really based off of what we know are the connotations that it gets from humans that are undergoing chemo, where if you have a friend, and everyone has a friend that's undergone chemo, or everyone knows someone that has undergone chemo, and it's horrible. It's something that in human oncology, those patients, those people are often not having a very good quality of life during therapy. And one of the biggest things, or one of the biggest changes in veterinary medicine, is that we don't accept those side effects. So as a person that deals with oncology patients, we want their quality of life during treatment to be just as good during therapy as it was before. So we really accept almost no side effects from patients that are undergoing chemotherapy, meaning that fewer than 20% of all of our patients that are getting chemo are going to have any kind of side effect. And even if we do notice a side effect, it's very important for that to be communicated, because often we'll change either the dose of the drug or the actual drug itself to, again, make sure that those pets are having just as good of a quality of life during treatment as they were before. And again, getting back to the push study, this is something where we have the ability now to undergo surgery, to be able to provide some benefit to get those patients to have the life-saving surgery that they need. But then after the fact, we can through this clinical trial actually perform better than gold standard care for these patients, because we can not only provide the chemotherapy, we're providing specific abilities to follow up and recheck those patients. And it's done in such a controlled fashion that we know that we are getting those pets truly vital care that is going to maintain their quality of life, improve the time that we have with them, and really define what is most important and most beneficial to the patients that unfortunately have been diagnosed with this disease.
Yeah, it's a super exciting study. I agree with you. And, talking again about the human medicine overlap, I mean, this is a very similar type of cancer as
Mhm.
angiosarcoma in humans. So,
Yeah.
looking at the data and looking at, what sort of works, I think is just fascinating what's going to end up coming out of the study.
Yeah, and the exciting thing about the translational ability of this particular research is that hemangiosarcoma is very unfortunately common in dogs, meaning that
Right.
for any dog that gets a internal bleeding, they have about anywhere from a 50 to 60% chance of having this particular cancer. On the flip side, it's a very rare disease
Right.
in humans, meaning that it's very uncommon for a human to be diagnosed with this particular disease, but it's still just as devastating for humans. And so it's very challenging on the human side to actually be able to do a prospective clinical research to decide what is actually effective for humans that are getting this diagnosis. Whereas we're seeing so many dogs with this particular disease, we can do something like the PUSH study where we can get 400 patients enrolled in a matter of, let's say, 1 to 2 years and follow them for the life cycle of the disease. Whereas in humans, because it's so rare, it's almost impossible to be able to do a randomized prospective trial on what is actually effective for those people. So we have the ability to, again, give our patients truly a treatment that would be unheard of outside of the clinical trial. And then take that information and data and say, this is going to improve the life of humans that have been diagnosed with this devastating disease at a way that even on human healthcare research, they can't actually do. So it's so exciting to see this and be a part of this, and exciting to see what the results will tell us.
Mm-hmm.
Excellent. What have we missed in talking about? Is there anything else that you are passionate about that we didn't ask you?
Yeah, I mean, I think we've covered a lot of it. The minimally invasive, the IR, the research. I think it's all so exciting, and the oncology care, I think, is something that is so exciting to be a part of in veterinary medicine. And I think that one of the big things that I would urge any client or any referring veterinarian that's listening to this is that the first step is always just making that conversation, making that contact point with a specialist about something like this. That's one of the biggest things that I would emphasize at any patient that I have that's diagnosed with a tumor. I think that it's never something where we go into the consultation expecting any kind of outlook or anything like that. We're just there to make that conversation. And I really want to emphasize that the most important step is really just making sure that that conversation is started. And so making that contact with your local specialist, whether it's surgery or oncology, to again talk about what those options are available for the pet, just because we're always into it to make the patient specific recommendations that will fit for the patient and the client.
So, just putting this out there then too, to a pet owner that really doesn't know much about veterinary medicine, we don't expect them to. If they have questions about, so they have a diagnosis and they want to know, fully what their options are, how do you recommend that people approach that? So, I mean, they're at their GP. What questions should they ask? And how often do you recommend seeking a second opinion? And just let's also reassure owners that it's okay to seek a second opinion, right?
Yeah, and I think that again, it's one of those things where it's absolutely important to talk to your primary care veterinarian about what's going on and what options are available, but then also ask your primary care veterinarian if they have any local resources through a specialist that would potentially be able to provide more advanced information about such a specialized topic. And again, I think that really comes down to the fact that no one is expecting every community private or primary care veterinarian to know all about a transarterial chemoembolization of a liver tumor and what the expectations are for the outcomes and the prognosis, and when to do that versus a traditional liver lobectomy. And so it's really just encouraging clients to ask their primary care physician who they know and who they trust in the community that can provide care like that. And then once that contact point is made, again, reaching out to those specialists and say, hey, this is what my patient was, or this is what my pet was diagnosed with. What would you consider as a couple treatment recommendations? And the one thing I always encourage is that, number one, it's always good to seek an opinion from a specialist and have that conversation, but it's very low pressure. Again, we're just there to have the conversation and provide informed information so that the client can actually make that decision, because I truly believe no one knows what's best for the pet other than the client and that family. So we're there to give an informed opinion about what our experience is, what we could consider for those pets, and then have them go back even to their primary care veterinarian and say, this is what we talked about. This is what we're considering for my pet. What are your thoughts? Do you think you would go this route or this route? Just because, again, the most important thing is to have that information available. And so, again, talking to your primary care physician, talking to any specialty clinic in the practice. And then if the information that you're looking for is not found, it's so great to seek a second opinion. And that's one thing that even if someone comes and talks to me and they say, you know, you talked about these 3 things and I was interested in option number 4 and you didn't mention that, is it okay if I talk to someone else that mentioned it? And absolutely. I think that the better informed you are about the disease and the options, I think the better you can actually make that decision for your pet.
That's awesome. Do
Yeah,
you
and I
have
think
any
vets have. Oh, go
stories?
ahead.
Oh, I was gonna say, do you have any
Sorry.
stories for our listeners that, you know, sort of a great case, like that, you know, really was an uplifting case or a case that you can remember either in residency or now in practice where
No
you just
personal
really enjoyed?
details.
Yeah.
Yeah. Yeah. I think it's I'm probably going to automatically go back to some of the IR or the minimally invasive options just because those are the ones that stick in my mind the most. But I think that some of the most rewarding cases are those that for instance, especially during fellowship or something like that, where they would come to Colorado State or they'll come to me at VSH North County and they'll say, you know, we were told this is what our pet has and we weren't provided options. We're just seeing if there's any chance that there's anything that we could do. And again, there's so many times that having that conversation with the owner, I can say, so yes, you have a potentially terminal disorder, or you have a patient with a very severe, potentially aggressive tumor, but we have option 1, 2, 3, 4, and 5 that we can all consider, and you get a variety of different expected outcomes, even if it's not going to be curative. Let's say you have a pet with a bone tumor, we can potentially do surgery to take away the pain related to the bone tumor. We could potentially do radiation to take away the pain of the bone tumor. We could do medications and drugs to take away the pain for that bone tumor. And while, yes, it may still be a terminal disease, we can give you 6 months of your same pet with a improved quality of life for that 6 months. That again, you can still enjoy that time that you have with them, but you just need that information to have that conversation, discuss. Yes, this is potentially a bad disease, but there's so many things that we can do to give you a great quality of life and give you more time with your pet. That I think that if you just hear that diagnosis of cancer, it can be deafening.
Yeah.
But to be able to overcome that initial deafening discussion, provide an ability for hope, let's say, for, again, a patient to still live with that cancer or to get a treatment for that cancer that someone else may not have heard of or known about, I think is so great. And it happens more commonly than you would expect, meaning that even over the last probably 2 weeks, I've had at least 2 consultations for a patient that had a prostate tumor that historically, again, we didn't have a good treatment option for patients with prostatic carcinomas. And so one veterinarian in San Diego heard that I can do an embolization for prostates. And because that one veterinarian heard that I could do that, I'm now seeing several consultations for prostate embolizations, just because, again, it's a new technique that if you don't know about it, you may not offer that. But again, making that initial conversation discussion point can really change the life of those patients.
Awesome.
Yeah, and speaking as a general practice doctor, like people are always like they'll dance around that question of a second opinion with you because they're worried they're going to offend you, right? We have a relationship with them for all these years. It's like a 12-year-old dog, and they don't want to upset you. It's never going to upset us. So we always want the best for our patients, and it may be that there's things that we know we don't know everything, right? So if you express an interest to me in pursuing this further, we're going to 100% rubber stamp that. And if you decide you can't have that conversation for whatever reason with your general practice doctor, vets don't generally require referrals. Some do, but most of the time you can just call up a veterinary surgeon and schedule an appointment. And yes, they are going to communicate back with your general practice doctor. So in my opinion, it is better to kind of get a referral, because I definitely have people that I work really well with locally and people that I just don't know very well. And so I'm going to guide you towards the people that I know, perhaps, and maybe that will be in the end a better, back and forth relationship. But, in the end, there should never be any like ego about asking for second opinions or asking, well, what is the best that I could do for this? Because a lot of the time we have these dogs, like you said, with bone tumors and things that, like the minute we talk about something like amputation, there's a recoiling and there's a I don't want to go that aggressively. And so a lot of the time vets will kind of turn it down and be like, okay, well then the best that we can do for this pet is going to be pain management and humanely euthanize it when it's time. But the reality is there's a lot in between, as you've just said, that doesn't have to be as aggressive, but can really give you good quality of life. And so, like, I just don't know all of that's available, and I'm going to do my best to send you somewhere if you want that information.
Yeah, and I think most vets honestly are relieved when people, I mean, at
Oh,
least for
so
me,
relieved.
it's so nice. I mean, if they want to see a specialist, if they want to get more information for their patient, I mean, if anything, that makes me feel great, right? Because like you said, it's you only know so much about one topic, right? And so we know a lot about, about all of the animals and all the diseases. We know about skin and surgery and all this stuff, but we don't know all of the specifics by any means. And so anytime that we get a diagnosis such as cancer, or if they've torn their ACL, or anything like that, we say, this is who you need to go to. These are the specialists. And yeah, it's not an ego thing at all. If anything, we're relieved.
Yeah, the worst that could happen is that you pay for a consult and don't decide to do anything further, but like it's really not that big of an expense in the end to talk to somebody with that level of expertise.
Yeah. And also there's nothing that I love more than hearing from a veterinarian to be like, I saw this oral tumor in a dog. It's a very rare tumor. I haven't seen one of these for 12 years. What would you recommend for something like this? And what can I offer or recommend to the client about kind of general expectations for treatment, for prognosis, for how we could go about setting up a consultation, just to, again, if this is something that I'm seeing every other month and it's something that a family care veterinarian is seeing once a decade, then again, I think that it's great just to reach out and be like, hey, is there anything new in this field that we can consider for this? And what is a general recommendation? Have things changed? I think that it's such again, a relief to set up expectations for the veterinarian appropriately, to set up expectations for the client appropriately. The more the communication between the group of, again, comprehensive healthcare veterinarians in the area is always better.
Yeah. Well, Chris, we really appreciate you coming on the show with us. We love having guests. It just makes the show fun, and especially reaching out to doctors and clinics on the West Coast and the Midwest. It's just been a ton of fun to be able to talk to people from all over the country. I really have enjoyed it.
Absolutely. Yeah, I've loved it. I think that it's so exciting, and again, there's so many new things that we're doing and exciting things that are on the horizon. So it's very easy to get passionate about some of these things, but it's really great to be able to spread the word on a lot of what we're doing.
Yeah, so we'll definitely end it there. Thank you so much to our sponsor, Ethos Veterinary Health. Don't forget to rate, review, and subscribe to us on your favorite podcast platform. I think I'm supposed to say smash the like button, right? Such. We also have a video version available on YouTube where you can find us at Ethos Veterinary Health.
And you can all find Chris's hospital, VSH North County, on Facebook as VSH North County, and on Instagram at Ethos Vet Health. So we appreciate you all for coming today, and we hope you have a great weekend.
Bye.
Goodbye.
Bye.